Hello and welcome to Panoramic Edition, where we discuss national, regional and international developments in depth. With complex and continually changing and challenging healthcare efforts, embracing development, exchanging expertise, and encouraging innovation is the best way to ensure its constant progress. With the goals of exchanging knowledge and expertise as well as promoting innovation and creativity in the field of women's well-being, Bahrain International Women's Health Conference and Exhibition has been recently organized under the theme Empowering Women's Health. To talk more about it, we are pleased to be joined here at the studio by the conference chairperson and president of Bahrain Obstetrics and Gynecology Association, Dr. Nouf Behzad, right after this. Welcome back. We are pleased to be joined here in the studio by the conference chairperson and president of Bahrain Obstetrics and Gynecology Associations, Dr. Nouf Behzad. Hello and welcome to the show. Thank you for being with us today.
Thank you, Sarah, for having me today.
The conference is on the mind of a lot of people, especially everybody who went to it and who saw a lot of the feedback after it actually happened. Specifically details within the show we'll talk about a bit more. But first, can you tell us a little bit about the concept of Bahrain International Women's Health Conference and Exhibition and what inspired to create it?
Actually, the idea came 3 years back when we revived the Bahrain Obstetrics and Gynecology Association, and I'm as the president of this association as well. I met with the board members and we were thinking, what can we do more? Let's have our mission, our vision and our goals. And one of these goals was to create a platform where experts can meet from Bahrain and from outside Bahrain, where they can meet and they can
talk about like the different or the newest.
Exactly, they can share their experience, their inputs in the field of women health.
Yeah.
So we thought that a Bahrain International Women Health Conference and Exhibition will be the start of this platform, and actually it's the platform. So we had our first version last year in May 2024, and it was a great event.
It was definitely a great event, and a lot of the feedback that was noticed is the tackling of newer topics in the field of obstetrics and gynecology, and also the sharing of experiences and the array of speakers that were there to be a part of it. What can you tell us about the main objectives of this Women's Health Conference and Exhibition?
Actually, we had two main objectives. One of them is to keep the doctors in Bahrain, those who are interested in women health, updated with what's happening across the globe.
Yeah.
And the second one is to raise awareness, not only in the medical field, but also in the public. That's why we had a dedicated time and a dedicated forum for the public in our conference. And this is the first time happening in Bahrain that along with a scientific conference, we have a dedicated forum for the public where all women can come, not only from the medical field, but any woman was invited to that. They can meet with the experts in different fields. They can ask direct questions. They can share their stories and their experiences. And that forum was really, really wonderful. And we had a great feedback. Actually, we dedicated 1 hour, and that 1 hour went more than 2 hours. The forum was moderated by the wonderful Mariam Faqihi, and the speakers were Dr. Mariam Baqi for the beauty and health, Coach Abir Matoug is a life coach, and we had a sport coach and a specialist specialized in biokinetics, Coach Mariam Ishaq.
Amazing.
Yeah.
That forum is actually, I'm smiling because a lot of the feedback that we got when we went online to research about the topic and everything is people talking in forums about the forum, about their experience in it. And a lot of them specifically mentioned the transparency and the openness that they were given the chance to ask and talk about.
It was
things.
for women. This time we dedicated it for the women. And we don't know next time what will happen.
Exactly.
But it was for the women this time, and they were it was, you know, like a friendly environment where they can talk without any
stigmas or anybody.
exactly,
Yeah,
exactly.
absolutely. That's amazing. What can you tell us about the addressed themes as part of the conference agenda before we go into deeper talks?
Our first version was a very classic obstetrics and gynecology conference. Our theme last year was recent advances in obstetrics and gynecology. We sat together with the organizers and with the scientific committee, and we thought, let's do something new. Let's do something which will attract the attendees and will make them sit until the last moment in the conference. So we thought, let's have a theme of empowering women's health. And empowerment is all about giving the woman the tools, the support, and the education to help her take charge of her health in all stages of her life. Because we believe that empowered woman is an empowered community, is a strong community.
Absolutely, absolutely. Especially with the empowerment in women, especially within the topics of obstetrics and gynecology, is a let's say it's a preventative measure for future illnesses, for so many things that we see have gotten out of hand because of the lack of knowledge, because of the lack of basic information that women might need in the future. Bahrain International Women's Health Conference and Exhibition featured some of the leading people, regional and international, within the field itself. What can you tell us about the speakers and how valuable was their contribution to this?
We were lucky to have 27 speakers from inside and outside Bahrain. Out of these 27, 10 international speakers. They were pioneers in their field. They were from Egypt, from Kingdom of Saudi Arabia, UK, Lebanon, Jordan, Ukraine, and UAE. Beside those, we had 17 more experts, local experts in different fields of medicine, not only in obstetrics and gynecology. And those speakers, actually, their presence added a great value to the conference. Their presence was really inspiring to the attendees.
Yeah. Especially that within the obstetrics and gynecology, there's a lot of crossover with other fields as well.
True.
And not having that kind of discussion is also limiting when it comes to finding out more about the futures. That's amazing, having so many people with that vast knowledge within one place to discuss it. And the proof of the success of it was the vast participation of people within the conference. So how do you value that?
After our success in the first meeting, we expected good attendance. And we had more than 200 attendees from Bahrain and from the GCC. The majority of them were doctors, obstetricians, gynecologists, also internists, GPs, family physicians, nurses also, staff nurses, midwives, physiotherapists, and medical students also attended this conference. The attendees were amazing. They were interacting with the speakers. They were discussing, and they were even sharing their experiences. So all of this, not only the speakers, not only the organizers, the attendees themselves added great value also to the success of this conference.
Yes, there's always something to be said about having hands-on experience and seeing the different kinds of issues that are faced within the healthcare community and then bringing them to light within a conference like that. Doctor, there was a very important factor that made the conference a huge success, which was the strategic partnerships that were set to set aside for the exhibition itself and for the conference. How did they contribute to enriching the material within the conference and exhibition?
Well, we had 4 strategic partners. The first was Temkeen, who's always supportive to us in all our activities. Bahrain Medical Society, because Bahrain Obstetrics Gynecology Association is under the umbrella of Bahrain Medical Society. The third strategic partner is the Saudi Women Health Society, and the fourth is the BDA, which is BDA Bahrain Doctor Academy, which is one of the leading academies in Bahrain in organizing such events. Also, we had a great contribution from the pharmaceutical and the medical companies, both financially to support the conference itself and even in the scientific program. And the good thing is also we had a contribution from the non-pharmaceutical companies like JPIC and Infracorp as part of their community partnership. And that was really a great contribution from all of them, which made their generosity actually made this conference a reality.
Absolutely, especially that most of these companies actually have their own clinics within their facilities themselves. Now, when we talk about the exhibition, let's go a bit more deeper into the concepts behind creating these kinds of exhibitions and why it is so important. Now, can you tell us a little bit about how this evolves within time?
Sure. The exhibition is a dedicated area in the conference venue itself. And we kept this area for all our sponsors. They have the right to come, to have their own booth, to show their products, to show their new innovative technologies in the field of obstetrics and gynecology. And all the attendees and the visitors of the conference was able to go through to see what's new in the market and to see what's new, what might come to Bahrain new. And all of this actually will have a positive impact in improving the health services in women's health.
Definitely. When we look at the improvement of different concepts like after procedures in obstetrics and gynecology, different kinds of wound healing, different kinds of technologies that the doctors themselves use in order to do less invasive procedures, all of that. These informations are actually shared on platforms such as this conference and this exhibition. How do you see the future conference looking when it comes to tackling different subjects and the future of it?
Actually, we raised the bar.
Definitely. With this one you did.
Yes. And we raised the bar for expectations, and our attendees are expecting a lot more now from us. And they deserve to have better version even than this. So we already chose the theme for next version, and we will meet soon with the conference scientific committee to put the suitable scientific program related to the theme, the new theme which we chose, and that will be a surprise, by the way. The most important thing for me is the continuity.
Yes, absolutely. Also spreading awareness when it comes to the topics about the conference is also collecting data at the same time for the next conference. So how do you see spreading that kind of awareness by using social media, by using healthcare workers that have attended or are part of the organizations? What can you tell us about how do you foresee spreading awareness about women's issues for the next exhibition?
Actually, raising awareness for women's health is one of our visions as Bahrain Obstetrics and Gynecology Association. We started as members of the association having campaigns, small campaigns, going to companies, going to schools, educating them about, like in the schools, about puberty, about the menstrual cycle, what happens at this age group, about HPV vaccine and HPV infection. And those areas, we find a defect actually in awareness. That's why we are concentrating on these areas. On the other hand, we are highlighting during the scientific program, we are highlighting some of the topics that we feel from our experience that we have little defect in it. And this will motivate the new doctors to just pick them up and go and search in them more and read about them and published papers.
Yes, absolutely. We talked a little bit before, and it was very important for you to highlight also that the awareness is not just for the public, it is for the healthcare workers.
Definitely.
Among everything. Why do you see that as an important factor?
The awareness is on two hands,
Yeah.
okay? We have the public, as we said, and we have the doctors. The doctors should know everything about what's going on and what the other party is thinking about. I mean, the public.
Yes.
So if we know the defect, we will be able to read more, to be updated, and to be able how to talk to them. Sometimes the patient will not come to you and ask you, and there's something hidden in her heart, especially women. So the doctor should be able to pick this and to gain this skill actually, and to pick this up and start the awareness, or start even the conversation with the patient.
To see the signs that are there, definitely. Doctor, the Kingdom of Bahrain has always been a leader when it comes to community medicine, to specialized medicine, to providing the best healthcare possible, not just for its citizens, but also for the residents on the island. How do you value the Bahraini government's provided support to hosting such vital events in the health sector?
The wise leadership of Bahrain puts the woman as a priority in all aspects, especially in the healthcare. They are encouraging us to educate more, to do such conferences, and to put Bahrain on the map. Bahrain is already on the map, but we want Bahrain to shine.
Definitely.
And so they are encouraging us to train more, and more training, we will be more updated, and this will be reflected on improving the health services in the field of women health.
Yes, yes. Really looking forward to that, because we here on the island, and me as a healthcare provider myself, we see how many programs there are dedicated specifically to women's health. There is family planning, there are family physicians that are specialized within women's health itself, that are available among all community centers. There are, of course, the obstetrics and gynecology consultants and specialists that are referred to by the centers. So it is really available in the community's hand to make that change, to take that step forward.
And we have to make use of them.
Definitely, definitely. We're here to provide that. Being the conference's chairperson, what can you tell us about your role and contribution to specifically the scientific committee? We know the general one, but the scientific committee.
Actually, a conference of this scale is not the work of one person or one group. It's collaboration, it's passion, it's shared purpose. We worked as an organizing committee, and the scientific committee worked hand by hand to make the conference meet its objectives. We were working to choose the topics related to the theme which we have chosen, and to choose who are the best speakers who can deliver the message.
Okay, amazing.
Yeah, and that was an amazing job. Actually, we worked for 1 year. But we were really enjoying working on this conference.
And having the people there that don't not only have the education, but also the experience in dealing with that must have been an important factor when it came to choosing who's going to do the speaking, who's going to be a part of the committees.
Definitely, definitely. The committee should be enthusiastic.
Yes.
Otherwise, the
it's
job
going
will
to be
not be,
Absolutely.
yes. And their job is to choose the best person for the best lecture.
Yeah, definitely looking forward to the next one. There are a lot of recommendations and outcomes that came out of this conference specifically. Some of them were surprising and some of them were expected, but what can you tell us about all of them?
There are lots of recommendations, clinical recommendations, new guidelines which we need to implement, to go more towards the mental health, to do more researches. But there's one very important recommendation, which is updating legislation to prevent and reduce the medical errors in medicine, particularly in the field of obstetrics.
Absolutely.
And we will be, inshallah, working on that soon. Inshallah. It will be a hard work, but we will do it, inshallah.
Inshallah. It's a huge step, inshallah.
Inshallah.
What are the, you've mentioned the plans to follow up on the implementation of these outcomes and the recommendations themselves. How do you see the community, the health community sharing in implementing these kind of outcomes?
We have the outcomes, and this is a challenging job to go ahead and implement them. The first thing we are thinking of is to publish these recommendations to those who attended the conference and to all the doctors in Bahrain.
Yeah.
The second thing is that we need to collaborate and engage with the healthcare facilities in Bahrain, both in governmental and non-governmental sectors, to be able how to implement these recommendations. And of course, we need to follow them in the next version.
Looking forward to doing that as well. How is the conference promoting research, and specifically innovative research, things that are maybe there, but looking at it from a different point of view or perspective?
Yeah, actually, we as healthcare providers, not only doctors, we live with research.
Yes.
So we are encouraging all the doctors to submit their researches, their papers, their posters, and present them in the conference. This is number one. And there is a competition, and there are winners as well. So this is a good thing. Yeah. And the second thing, as I told you earlier, that we are highlighting during the scientific program, we are highlighting some of the topics which we feel that we have a defect in. Like, everybody knows that PCOS, and lots of girls are coming to the clinic, we have PCOS, and they are diagnosing themselves, and they are treating themselves. There are lots of research about the diagnosis, about the treatment of this condition, but we have a defect in studying a certain age group, which is an adolescent age group with PCOS. And this is a very important age group, which we have to study, and we don't have data in Bahrain. So this is one of the examples. That,
actually, even in the region, because looking at the numbers, the numbers, I mean, internationally there are, but again, within our region, there is a different dynamic and a different geographic dynamic as well, and the people here as well.
Correct.
But that's amazing. I mean, having that goal will make it easier, because there are a lot of tools within the grasp and the hand of the committees.
And we have lots of motivated doctors.
Yes, you do. Yes, definitely. So that's one thing, looking forward to research within those topics, especially because, as you've said, especially within a certain age group, school age and above, we see a lot of knowledge that is impaired due to stigma, due to not wanting to have that conversation or not knowing to whom to go to. So that will solve a lot of these issues. What are the aspirations that you put for yourself and the expectations for the upcoming version of the Bahrain International Women's Health Conference and Exhibition? Other than raising that bar, where do you feel it's going to go towards?
It will go somewhere. We have to choose a new theme, and we have to work on that. But my vision for the women health in general, that a woman is a daughter, she's a wife, and she's a sister, and she's a mother, and she's a friend. We have to take care of her. And I believe that every woman should know her rights, not only in the medical field, not only in the health-wise, but socially, economically, mentally, and she should know how to access these rights.
Absolutely. One other thing when it comes to caring for women within the health field itself, there is always a defect of information, because you never know what to say or what the person in front of you wants to hear as the patient themselves. So trying to break that barrier and having that honest scientific...
This is a skill. Some people are having this skill, these skills, and some people can learn it.
Yes.
You can learn it, definitely, but you have to practice.
And it's very important to really have that, definitely.
And the most important is that when you deal with a female,
Yeah.
you should consider her like your sister, your
Exactly.
mother, your daughter. Then only all the barriers will break.
Absolutely. And then understanding that that person is going to help someone else because of what you said is also a good incentive to think about. As the conference chairperson, what is your personal vision for the future of women's health, specifically in Bahrain and the region in general?
As I just mentioned, that I believe that every woman should know her right.
Yeah.
That's why when we design a conference, it's not only for obstetrics and gynecology, because I'm an obstetrician gynecologist, but it's all women health, taking care of the woman in all the aspects of her life. Do you know that we have a lawyer as a speaker?
You're going to legislation. There you go.
Yes.
Yeah.
So we want to take care of the woman in all aspects in her life, and we want her to be empowered and to know her rights and to know how to access her rights, because we really believe that an empowered woman, a stable woman, and a stable community.
Absolutely. When it comes to the region, we hear a lot about the advancement of obstetrics and gynecology fields within different topics, whether we've talked a little bit about it, aesthetic, IVF, even when you go into cancerous and surgeries and everything. But what is the future of the region? And do you see it as a bright future? Is there potential?
Definitely.
Yeah.
Definitely, there's potential. The government is supportive to us. The doctors are enthusiastic and they want to learn more. We are lucky in Bahrain that we have 2 medical schools.
Yes.
Okay, and the government is supporting us when we finish our bachelor's in medicine, that we go to subspecialize.
Yeah.
And I'll tell you something, in obstetrics and gynecology, we have almost all the subspecialties needed in Bahrain.
Yeah.
All this, we have the fetal maternal medicine, we have the reproductive medicine, urogynecology and pelvic reconstructive surgery, gynecology and oncology, and there are some doctors who are specialized in minimal invasive surgery. They are amazing, doing a great job. And the new field is coming with aesthetic gynecology, and we have certified doctors in that. So we are there, but we need to shine.
Yes. It's a fruitful landscape with a lot of potential in the future, inshallah. Well, before we go towards the end, our last question, when it comes to a woman's health, it's always been at the forefront, but it always has been, don't want to say sidetracked, but it always has been part of the routine. So there was no real focus when it comes from the community on it or from people in general, doctors, of course, nurses, of course, but people do not understand that it is a different field by itself than regular health itself. So what is your message that you would like to share with young women who are aspiring either to enter the field of research or as women themselves being a part of the dynamic or the demographic that this is made for?
Okay. My advice is from the heart.
Yes.
Okay. For each and every doctor interested in women's health, believe in yourself. Believe in your ideas. Work hard. And do not be afraid to lead.
Yes.
Because women's health field needs passion, creativity, and definitely love.
Yes. Yes, totally understood. And how about the young women who are seeking answers but are afraid to ask them or go to?
Do not be afraid and ask.
Yeah. Yes.
Whenever you have the chance to ask, ask.
Yes, you have the availability
Everybody
of resources.
Everybody is having the right to ask question, but you have to choose to whom you are going to ask.
Yes. Well, that was our last question, but on the side, just the last question to get your take on it. Now with technology and the uproar of AI when it comes specifically in research and everything, we see a lot of people going to get diagnosis off of AI specifically, not understanding that prompting AI is a big factor in getting an answer. So your message to people that try to diagnose themselves, AI is a very useful tool.
It's a very useful tool.
Yeah.
It's very useful.
Yes.
But it's an AI, it's not a human being.
Yes.
Whenever you will read, you have to go to the doctor again
Yes.
and make sure that what you have read is your case,
Yes.
not your friend case.
Yes.
Because we individualize cases.
Absolutely.
The AI does not individualize. The AI will tell you the answer of the questions the question
that you asked.
you provided.
Yeah.
He doesn't know you.
Doesn't know the demographic, doesn't know your food
Definitely.
habits, doesn't that's
Definitely.
where the human factor comes in.
And this is the importance of meeting a doctor and talking to a doctor, because the doctor will ask you specific questions. The AI will not ask you these questions.
Absolutely.
You have to provide them. But sometimes the patient does not know that this information is important.
Yeah, yeah. But
That's
having
why-
the tool and taking that initiative is a good step, but you need
Definitely.
to follow up.
Definitely. You can Google, but you have to ask, is this correct or not?
Absolutely.
Yeah.
Thank you so much, Dr. Nouf Behzad, President of the Bahrain Obstetrics and Gynecology Association, for being with us and answering all of our questions. Thank you.
Thank you, Sarah. Thank you.
Thank you also, dear viewers, for watching, and we will see you next week in another episode of Panoramic Edition.